Hi, I'm Jason. I'm the Neurosurgeon Plastics Clinical Nurse Consultant here at the Queensland Children's Hospital. I've been nursing for about 19 years now, and I think I discovered very quickly that it's really important to have a supportive network for staff and for the family. And I'm just one member of a big team of people that are here to support the family through their journey. One of the things I learnt when we were putting this role together was after a discussion with Dr. Redmond, who was the Director of Neurosurgery at the time, said one of the most important things is to be accessible to patients. So I really took that on in developing this role, and I've really made a point of going back and checking on families, checking if they've got any extra questions after a ward round, keeping that communication really clear so they know what's happening and what to expect, and we can alleviate any concerns as quickly as possible. Rowan and his mum and dad are a family I'll never forget. I can remember back to their early days in ICU and things were looking really quite grim at one stage, and the surgeons had been through and said, we've really done all we can do for Rowan at this stage. It's up to him now to recover. And he was such a little fighter, and getting to know him throughout the years, he has such a positive personality. It was really amazing to watch him recover through a terrible injury. Specifically with Rowan's family, they're given so much information in a short period when the medical teams come through. So I really made a point of going back after ward rounds and just double checking if they had any questions. And sometimes even if they didn't have questions, I just sort of spoke to them a little bit about what I'd want to know if I was his parent, because I have kids myself, what I'd want to know. And sometimes they don't know what they want to know until you tell them, and often find that quite reassuring, or just happy to have the knowledge of what the plan is, what's the next step. Like Rowan and all our patients, they really rely heavily on their parents and carers to support. And where I come in is I then can help support the parents who have extra questions or just need to have clarity of the plan going forward. But I too also then am just one member of a large team who I can rely on heavily for any questions, whether it be about mobilisation with a physio or an OT for different equipment to help support a patient, speech therapists, dietitians. Probably most importantly is the medical team, who I can really lean on to get that clinical information about what can we do to give Rowan and patients like Rowan the best care possible. One of the ways I connected with Rowan is he always had a joke. He's going through such a tough time, but he always had a joke for us once he was well enough, and that just really connected me a little bit back to my family and my son, who's a similar age. And I'd often go home and try and remember the jokes he told us to tell my son, and we'd have a good laugh. I was really quite humbled when I got the call to tell me about the award, and just a member of a big team that we all just here trying to do our best to help sick kids get better. But it was really nice as well, it was really picked me up and just made me feel like we're doing the right thing here, like we're going the right direction, helping kids and doing some good. If Rowan and the family were here, I just want to say how proud I am of him, that he's come so far and he's done so well. And to his mum and dad, it's really a traumatic experience for them, and they've been amazing the way they've coped and helped support Rowan through this journey. So yeah, I just would like them to know just how amazing that they've done and they are. Thanks Rowan, you're a legend. I really can't wait to see what life has in store for you. I think you're destined for great things.